My name is Neerav Goyal. I'm one of the associate professors in the Department of Otolaryngology, and I'm the director of head and neck surgery here. We think about our senses, and we sight, smell, touch, hearing, but we also think about how we communicate with people and how we enjoy life. And so really speaking, swallowing, those are important aspects of living. Unfortunately, when we're talking about taking out cancers that are more advanced and we have to remove the voice box, we really are robbing patients of their ability to speak. Potentially temporarily, but in some patients permanently. And so that's really the biggest change that they're worried about. Patients often are concerned about the fact that they'll have a permanent hole in their neck or a stoma, and that's something that also worries them. And so we do a lot of work, and we spend a lot of time counseling our patients about what it is like to live without a voice box. Fortunately, with YouTube and with the internet, a lot of patients who have done well after laryngectomy are very vocal, and it's good to know that we can restore voice for the majority of our patients after this type of surgery. I think there's a lot of things that are different between, when you look at a patient immediately, between a laryngectomy patient and a tracheotomy patient. Many of our laryngectomy patients will not have an appliance in the neck. They will just have a hole there that looks like it's pretty well healed. There's no connection going up to the mouth, so usually they'll see the trachea coming at an angle as opposed to seeing space going upwards. Many of our patients, we've encouraged them to wear bracelets, so oftentimes they'll have an identifying bracelet that says that they're a neck breather, and having that information is an easy, identifiable, quick way to know exactly what type of patient you're dealing with. I think the biggest challenge with a laryngectomy patient is that we're just not doing as many of them as we used to. So with the advent of chemotherapy and radiation, for many of our advanced laryngeal cancer patients, we can do non-surgical therapy, save their voice box, and cure the cancer. But for those patients that need their voice box removed, it's the only way to cure their cancer. We probably have about 13,000 to 20,000 patients who are diagnosed with laryngeal cancer every year, and of those, only a small percentage of them have to have their voice box removed. And so in a population of 400 or 500 million people in the U.S., the number of patients who actually have their voice box removed is very, very small percentage-wise. This is called a Lary stent or a Lary tube, and so this is what would sit in a patient if they have a laryngectomy, with the curved portion sitting into the trachea, and this is the part that you would see on the outside on the skin. For some patients, they'll have something called a humidity and moisture exchanger, and that usually just sits in this cup here, and what that does is it will humidify the air as patients breathe in. It acts very much like someone's nose or their mouth would work. Other patients who have a laryngectomy, they may not have a tube that goes into the trachea. Instead, they have a plate that just sits over the hole, and that works in very much the same way as the Lary stent does, where the humidity moisture exchanger fits in like this, and the airway would sit behind it. In contrast, somebody who has a tracheotomy, you can see that this is something that the paramedics are probably very familiar with. There's a plate that sits on the skin, there's a portion that extrudes beyond the skin, and then this is the part that would sit in the airway. They'll have more room above, which will connect to the voice box and to the mouth and the throat. Patients who have a cuff tracheotomy may have a balloon at the end, but not all patients will have a balloon there. So if we take a look at these two devices, you can see that the one that's for the laryngectomy looks very different than that for the tracheotomy. It's much more flush to the skin. Usually it's made out of a clear plastic. In this case, this represents the wall that separates the trachea from the esophagus. We can see the prosthesis in place, and what this does is when air comes through, when they cover the stoma, air comes through, and it'll come out the mouth and allow them to talk. Laryngectomies represent a pretty unique population. They're a small portion or percentage of the patients that any of us see, but they have very unique needs and very unique ways of caring for them in an emergent setting. It's not only the paramedics, but a lot of our physician and allied health providers are not familiar with this type of patient, and so we're doing a lot of things within Penn State Health to really educate our physicians about this type of patient and make them more familiar with how to manage patients with laryngectomy.